I'm often asked, what is biofilm? Biofilm is a sticky substance that we find in our mouths. It sticks to our teeth, our gums, our tongue, our cheek, and biofilm is made up of quite a few bacteria. Most of those bacteria are very good for us, but quite a few, 6 to be exact, are very bad for us. And from these bacteria, we find the connection between the mouth and systemic disease. Now we find one of those bacteria is called Porphyromonas gingivalis, PG. PG has been shown, if it's found in someone's mouth, their risk for heart attack goes up 13 times. That is a huge indicator of future disease for this patient. I know of no other test that we have in healthcare that can show that. There's a burden on dentists to take care of that, but there's also an opportunity like nothing we've ever seen before. We're an integral part. Now, how do we address it? Number one, we have to learn how to diagnose it. Diagnosing is simple. It's different than what we were taught in school, but it's simple. It's a salivary rinse, salivary diagnostics. We get a report that comes back to us in about 3 or 4 days, shows us exactly what's there. I can't visually see this in my patients, but when I get this report back, I have found PG present in patients I would have never thought they would have that. I like to think of it as looking through a different lens than we were taught traditionally. When you look through that lens, you can now see ways to help them. So, okay, we find it. What do you do? Well, number one, if your team has an approach along with yourself, you can educate the patient. I find PG in a patient's mouth, we have to take care of that. I cannot, as a dentist or a healthcare professional, overlook that. I have protocols in my practice to address PG. We do mechanically remove biofilm, but we have to do it in a microbial approach where we address the bacteria we don't want to be there, so we eliminate that as a risk factor for their overall health. We use lasers, we use trays, we use oxygenating systems, we use antimicrobials, we use systemic antibiotics, all specific and customized to the problems that that patient has. Once we can customize for them, then we can verify at the end of the care, certify that they no longer have the bacteria we don't want, and then we can maintain them and carry them through so they eliminate that. It's, you know, think about it. Smoking used to be and it still is a big problem, but you get somebody, you identify the problem, don't smoke. Then you go ahead and give them systems to get them through it and then help them afterwards, and they don't smoke any longer. They take that off the table as a risk to their health. We do kind of the same thing where we eliminate the problem, but then we have to maintain it and go forward. It doesn't do us any good if we don't get them on systems to maintain going forward. They know the problem, they will take care of it.